Good afternoon. How are you today?
Good.
Good. All right. My name is Haley. I'm going to be your nurse today. Before we get started, I'm going to go ahead and give us some privacy, and I'm going to complete hand hygiene. Is it all right if I touch you?
Yes, ma'am.
All right. If you could, can you go ahead and verify your name and date of birth for me?
Sonia, Washington, September 27th, 1987.
Fantastic. And before we do anything, I'm going to go ahead and verify orders. All right. Before we get started, are you in any sort of pain today?
No, ma'am.
No pain? All right. So today we're going to go over a cardiac assessment, a respiratory assessment, and then just give you a little bit of information on safety. Is that okay with you?
Yes, ma'am.
All right. So listening to your heart, do you have any sort of chest pains, any sort of difficulties?
No.
No chest pains? All right. Do you have any sort of history of pulmonary edema, any sort of blood clotting issues?
No, ma'am.
No. Are you on any medication?
No.
All right. So I'm going to go ahead and listen to your heart. We are going to start here. Alright, and going to the mitral point. Alright, is it okay if you lift up your breast for me?
Sure.
Thank you. I'm going to listen here. I'm going to listen here. All right. So no sort of irregularities I can hear. Nothing out of the ordinary. If there was a history of murmur, or if there's any issue to think of a murmur, we would use the bell and go over the same spots. Before moving on, I'm going to go ahead and see your capillary refill. Alright, it refills before 3 seconds, which means you're good. I'm going to go ahead and listen to your pulses. We're going to start at the wrist, or the radial pulse. I'm going to go. Alright. Then we're going to go ahead and do the heel. And then we're going to do the dorsalis pedis. Alright, no issues there either. Moving on to the respiratory assessment. Do you have any sort of trouble breathing?
No, ma'am.
No pain when you breathe? No sort of tightness of the chest feeling?
No.
Nope. Alright. So I'm going to go ahead and give your lungs a listen. And deep breathe for me. Perfect. Oh, thank you. And then once more down here. Alright. Then I'm going to go ahead and listen to your back. If you can move forward just a little bit for me. Thank you. And then just breathe whenever you feel my stethoscope touch you. Alright, I'm going to listen down here. And if you could go ahead and move your arm across your chest for me so I can listen here. And then once more on the other side. Perfect. There's no sort of abnormal sounds that I'm listening to. Everything sounds clear. Now, if you did have issues breathing or you simply just wanted to increase the strength of your diaphragm, what we would use is called an incentive spirometer, which what you would do is here you would put your mouth to it, you would inhale, hold for 2 to 5 seconds, exhale, hold for 2 to 5 seconds, and then repeat about 10 times an hour every time there's a commercial. If you're having a cough, what you'd want to do is you would cough, do a productive cough, see if you can get anything out, which reminds me, do you have any sort of cough, any sort of tickle in the throat?
No, ma'am.
No, ma'am. All right. So I'm assuming there's also no sputum that's coming up?
No.
All right. So that's another thing we would look for is if you were coughing, if sputum came up, just to take a second and notice the color of it, the texture, stuff like that. But with the incentive spirometer, just to make sure that you understand, could you explain to me how it works?
Yes, ma'am. You said that I would take it and put it up to my mouth. I would take a deep breath, hold for 2 to 5 seconds, and then release, hold for 2 to 5 seconds, and do it 10 times every hour.
All right, that works perfect. So moving on to safety, do you ever have any sort of history of falling?
No, ma'am.
No history of falling. Do you have any sort of secondary diagnosis that would maybe cause falling, anything like that?
I have type 2 diabetes.
Type 2 diabetes, all right. I will definitely take note of that. Do you have any medication that would cause like dizziness or anything like that?
No, ma'am. Not that I know of.
Do you use any sort of walker, a cane?
No.
Do you have any difficulty walking? Like, do you limp? Do you have any sort of like step off whenever you walk?
No.
No? All right. So doing that, if you felt any of those things, the first thing to do would definitely be to take your time with walking. If you felt yourself becoming dizzy or lightheaded, stop whatever you're doing and find the nearest place that you can safely sit down. If you needed help, make sure that you have friends or family around you that you can help or have them help pick you up if you're falling, or just be there if you're dizzy. And I think that's it. Is there anything else that I should be made aware of?
No, ma'am. I think that's everything.
All right. Thank you so much.
Thank you.